All right, let's dive right into this explainer and unpack the massive, newly released NFHS-6 health survey. We really want to see how India is truly transforming right now. This isn't just a boring collection of spreadsheets. It is a profound look under the hood at the lives, the choices, and the well-being of over 1 billion people. Whether you're an academic, a policy nerd, or honestly just someone curious about the trajectory of the world's most populous nation, this data is absolutely foundational to understanding exactly where we're heading.
Now, because this data set is frankly completely massive, we've structured our journey today through a simple life cycle approach. Here's our agenda. 1. Mapping India's health. 2. Mothers, infants, and children. 3. Fertility and family planning. 4. Adult health and lifestyle. And finally, 5. Women's empowerment. So let's just get right into it.
Section 1. Mapping India's health, focusing on the national infrastructure. Because before we can even begin to talk about individual health outcomes, we've got to establish our baseline environment. Just pause and think about the sheer logistics for a second. Researchers literally knocked on doors and gathered data from nearly 680,000 households to give us this incredibly accurate picture. They went from crowded urban centers out to the most remote rural villages, talking to hundreds of thousands of people. Whenever we discuss these percentages today, just remember the immense, awe-inspiring logistical triumph required just to gather this information.
Now, if you were to look at the raw source material, you'd see endless, kind of intimidating rows of numbers. It is super easy to get completely lost in all that statistical noise, the standard errors, the demographic cross-tabulations. But don't worry, our goal today is to pull out the signal. We want to find the actual human story hidden inside all those rigid columns.
Okay. Check out this massive leap. We're seeing a nearly 20% jump in households covered by health insurance in just a few short years. Going from 41% in the last survey to over 60% today, that is a monumental shift in how families handle medical emergencies. Plus, electricity and clean drinking water are creeping right up to that 100% mark. So the baseline living conditions for the average household, they are demonstrably more secure. And we're also witnessing a massive digital awakening across the country. Women's total internet usage has nearly doubled. Just a few years ago, only a third of women had ever even used the internet. Today, it's almost 2/3. Now, sure, a distinct urban-rural divide definitely still remains, but this isn't just about scrolling social media. We're talking access to information, banking, telehealth, education. It's a true paradigm shift in connectivity.
Moving on to Section 2, mothers, infants, and children, the beginning of life. Because usually when a country gets richer and more connected, the very first place we look for an impact is in maternal and infant care.
And the data absolutely backs that up. We are seeing a steady, really positive continuation of mothers delivering in actual health facilities instead of at home. Crossing the 90% threshold for institutional births nationwide is a massive, undeniable public health victory. It literally means that the vast majority of newborns and moms have immediate access to skilled health pros if any complications pop up.
But here's a totally fascinating contrast. More than half of all births in private facilities are C-sections, compared to a much, much lower rate in public ones. Obviously, having access to surgical interventions saves lives, but a 54% C-section rate in private care? That definitely raises some complex questions about healthcare economics and medical protocols. It really highlights how the type of facility drastically changes the medical experience.
Now, as for childhood nutrition, the numbers show it remains one of the most stubborn challenges on our progress report. The good news, stunting dropped from over 35% down to roughly 29%. That is fantastic. It represents millions of kids growing to their full physical potential. But wasting, which reflects acute malnutrition, has barely budged at all, hovering right around 19%. So it shows us exactly where future interventions need to be hyper-focused.
All right, Section 3, fertility and family planning, focusing on reproductive choices. This is where we really start to see the shifting cultural and demographic tides of the nation.
Before we throw more numbers at you, let's quickly define a crucial piece of health jargon so we know exactly what we're measuring. Total unmet need. Basically, this measures women who aren't using contraception but actually want to postpone or stop having kids. It doesn't tell us who wants children, but who currently lacks the tools to manage their family planning how they want to. Bridging this gap? It's all about providing agency.
And the really great news here is that the total unmet need for family planning has successfully dropped to 8.5%, down from 9.4% in the previous survey. Now that might sound like a tiny drop, But in a population of this size, we are talking about millions of women who are now empowered with the contraceptive access they previously wanted but just didn't have. It's a direct, measurable indicator of improved healthcare delivery. And speaking of family planning, while the national average sits exactly at 2.0, urban populations are actually falling well below the replacement rate. Demographers generally consider 2.1 to be the replacement rate, the point where a population just replaces itself generation to generation. With urban centers down at 1.6, we are observing a huge demographic transition towards smaller family sizes, a trend we see mirroring a lot of advanced global economies. So that brings up a really vital question. As our demographics shift and lives get longer, are those lives actually healthier? We're successfully managing birth rates and infancy, sure, but what happens as this massive population ages into their 30s, 40s, and beyond?
That takes us to Section 4, Adult Health and Lifestyle, looking at the modern disease burden. You see, as living standards improve, the kinds of health challenges a country faces fundamentally transform.
As infectious diseases decline, this data reveals that lifestyle conditions like hypertension and high blood sugar are steadily creeping up across both genders. We are looking at roughly 1 in 5 adults dealing with elevated blood pressure or blood sugar issues. It's the classic double-edged sword of modernization, right? With better infrastructure and less physical labor, we often get more sedentary lifestyles and dietary shifts that really challenge the cardiovascular system.
And when we slice this lifestyle data by gender, a massive disparity emerges with tobacco consumption. Over a third of men report using some kind of tobacco, compared to less than 1 in 10 women. This isn't some biological difference. It's a deeply ingrained social and cultural one that carries immense long-term implications for cancer and respiratory disease rates down the line.
We see an almost identical, super stark gender divide when we look at reported alcohol consumption. Nearly 19% of men consume alcohol, compared to barely 1% of women. These behavioral metrics are absolutely crucial for policymakers because they show that when we're designing public health campaigns around substance use, the target audience is overwhelmingly male. Now, take a second to ponder this. How does economic and social independence actually impact overall societal health outcomes? Because health isn't just about what happens in a doctor's office, is it? It's deeply rooted in who actually holds the power within a household. Which brings us to our final and perhaps most transformative chapter, Section 5, Women's Empowerment, examining agency and safety. Ultimately, a nation's health is just intrinsically tied to the autonomy of its women. When women can make choices about their bodies, their money, and their time, literally every single health metric we've discussed today improves. And the survey recorded some incredible surges in financial and digital autonomy for women over just a few short years. Nearly 90% of women now have a bank or savings account that they use themselves. That is a massive 10% jump. Add to that the significant surge in mobile phone ownership. When you combine those elements, money, connection, and decision-making power, you have a recipe for unprecedented independence.
And most importantly, this increased empowerment directly correlates with a tangible, significant drop in reported domestic violence. This might just be one of the most encouraging numbers in the entire report, while the reality is that 22.3% is still far too high. A drop of nearly 7 percentage points in just a few years, that represents millions of women experiencing safer domestic environments. It is a powerful testament to what happens when financial and social autonomy expand.
So as we wrap up this explainer, I want to leave you with this thought to ponder. As India scales its access to health infrastructure and digital tools, how will we shift our focus to the overall quality of that care? The numbers show we've built the foundation. The hospitals are built, the bank accounts are open, and the internet is connected. But the story of the next decade won't just be about access. It's going to be about the quality of the treatments, the depth of the education, and the continued dismantling of disparities. Thank you so much for joining me today. Keep questioning the data and stay curious.